The Ebola outbreak in the Democratic Republic of the Congo has triggered a public health emergency of international concern declaration by the Director General of the WHO. It's the first time the DG has made this kind of a designation without convening an emergency committee. And that makes sense, given that this is something that already was very big by the time the WHO was notified. Over 200 cases. We usually hear about these when they're in the double digits. This is the triple digits, meaning this has been going on for some time. It appears like the first case might have been back earlier in April in someone that was sick on the 24th and died on the 27th, and that's set off multiple transmission chains that we don't really know about. And we've got two cases in the capital city of Uganda, the neighboring country, Kampala. There was a rumor of a case in Kinshasa, the capital of the DRC. That makes kind of raises the stakes because those are bigger, more densely populated places. That Kinshasa case seems to have tested negative. This is the 18th Ebola outbreak in the DRC, so they are used to dealing with this. But it is in the Ituri province, which borders both Uganda and South Sudan. It is an area that we know has problems with civil war and strife and difficult to reach. It's going to take a lot of work to really get a handle on this, given the size of it and the fact that there are multiple chains of transmission. A physician named Dr. Stafford, he is being evacuated to Germany for treatment. There's going to be some issues with how they deal with quarantine if they're going to bring these Americans back. Obviously, our quarantine spots, a lot of them are taken by hantavirus patients. Maybe these individuals will quarantine in Germany, and the one will receive treatment. The strain is the Bundibugyo strain. No vaccine available, no countermeasures. There is an experimental vaccine that seems to be about 50% protective in monkeys, and there probably will be some antiviral clinical trials that occur in this setting at real time if they can. Another thing that happened is that the US government has invoked Title 42, which is a way to block entry of individuals. They've put in a ban of individuals coming from the DRC, from Uganda or South Sudan if they've been there in the last 21 days. That's going to last for a month. I don't think this is going to be helpful. I think we can do travel screening and do this in a much better way. This just is going to create stigma and then maybe lead to more people doing travel bans. And remember, travel bans and border closures don't actually make it easier. They make it harder to get things into the outbreak zone. So we'll see what happens. The other issue is that the testing was negative initially because they were testing for the usual suspects of Ebola, which is the Zaire strain, using a kit that only tests for one type of Ebola.